400 fucking leg kicks, bro. You're a gnarly savage, you know, right?
It's like
God bless, man. And after I watched, so like we were texting, it was a Saturday night.
Yeah,
I was so you sent me the link. I was like, I have to watch it now, right? So I gotta watch this fight. I'm watching it, and then I could not fucking sleep. I'm like walking around my apartment, like fucking all jacked up. I'm like, just like even on my phone in my bedroom, I'm watching it, and like the leg kicks were thunderous.
Yeah,
you gotta give that guy fucking credit. You
monster.
Dude, you fucking
I
wore him a few times, like clean shots. And I was like, how is this? And you could see he was like out on his feet.
The fight should have been stopped.
He was out on his feet.
He's spit his mouthpiece out 4 times. Yeah, come on.
Right. Well, one time, the first one was like, I mean, square.
Yeah, I mean, he's not biting down on it enough, maybe, but
right.
But in the third round, it came out. Seemed,
repetitive.
Yeah,
like there was not much action.
It was
left in his face.
voluntary. yeah.
He was just looking for anything to stop, man. Dude, just like your pressure the whole time, man.
Yeah,
it was awesome.
It was a good performance for me, man. I'm really happy with that whole thing, man. But
all right, let's talk about these shins.
The shin, the foot, man. It starts with the right one, man. It's pretty bad.
So the right one was the one you were. So you took a lot of the damage on the kicks you were throwing.
Right. So he actually kicked my left calf a bunch. That's kind of swollen.
Yeah.
But
I figured your right shin was the shin that.
Yeah, I mean, ideally, if majority landed on the actual shin, I wouldn't be in this much pain. It's the fact of the matter is, while you're throwing it in split seconds, the distance is changing by inches. I mean, that's what's going to happen there.
The lower side,
the blade of the foot, the ankle. I mean, dude, it's.
Oh yeah. Oh man.
It hurts to take a sock off, man. I can't get my shoes on, man. I have extra large flip flops. Slides on purpose, man. That's crazy.
Yeah. Oh my god. So obviously this is all bleeding. That's draining down into the foot because of gravity. You know what I mean? So it's not necessarily that this is damaged here. It's more that all of that contusion, all that damage is happening in the front. And this is why we need to get this swelling out as soon as possible.
Yeah.
So also why I told you no more ice, because icing is just gonna kind of maintain this status quo. So let me see that one.
A lot.
Elevation's gonna be key, movement's gonna be key. We're gonna talk about all these things.
I mean, dude.
And this is more from when he got you.
This isn't. I mean, it looked worse on camera, man. I think because I'm just
you're still
pale.
You're still
bright lights, but
right.
The knee is one thing, but this foot, man, it's never been this bad.
Okay.
And it has me thinking I should fight a little differently. Honestly, this is just can't keep happening after each fight, you know.
Right. Well, so what we're gonna go through today is kind of like a way to accelerate this recovery.
Yeah.
You know what I mean? Because the way we take care of it this week is going to ripple into the next month.
Okay.
Facts. It's just the way the physiology works. So because it's in your lower extremity, we really want to make sure that we're getting rid of this swelling, so elevating it, moving it as much as we can. So we're going to take this over to the table. For those of you guys joining us, welcome back to Session Sit-In. It's been a while since we've done a video. I got my boy Charlie the Cannibal Campbell coming off a Cage Fury victory.
Charlie Campbell, 2-1. His professional debut, just 25 years old. Oh! Right hand on the chin.
Heavy right hand.
Gonna sit in trouble here. Campbell swarming, trying to finish. The offense is like, oh, there was the right hand, the leaping knee. Listen, the leg kick knocks him down as well.
Right. And your winner by unanimous decision, out of the red corner, Charlie the Cannibal Campbell.
But honestly, if looking at your shins and feet, I don't know.
Should have seen the other guy.
Yeah. We'll leave it at that. You go watch the fight online. You should have seen the other guy.
Oh,
okay.
Man.
Gonna lay on back, brother. Let's get you comfy. Get these legs up. So obviously we are going to be dealing with some acute care stuff today. Let's pick these legs up for me. So the first thing right off the bat is we're going to need him to elevate, right? So this is a nice little wedge pillow. You can get these online on Amazon, things like that. We're really going to focus most of our work today on obviously his right leg. This is the leg he was throwing a lot of his leg kicks with, and you can see he's taken quite a bit of damage there. Got some bruising around here, and again, we were just talking about how this bruising drains into this space. It drains down due to gravity. And we can also see a bunch of swelling kind of around this lateral malleolus on his left ankle as well. This is from you taking leg kicks on this side. So this is your front leg. Right, okay. So in today's session sit-in video, we are going to treat this end of the Ice Age style. I'm going to show you guys a modern approach to acute care, why we don't want to necessarily ice this stuff, and how we can accelerate the recovery process for him, not only right now, but in the week coming. So without further ado, we're going to glove up and get this thing going. So I just added these extra bolsters just to give him a little bit more kind of downhill. Okay, so what we're going to start with is some lymphatic drainage massage. In case we're going to roll this up actually. And the key to draining the swelling out of here actually is to clear some of these lymph channels that are actually in your abdomen. So we're going to kind of work this whole groin and thigh area, and then we're going to get down to the ankle and start kind of milking some of this swelling out. Nice. We should see a pretty good reduction in this size even just today. And then what we're going to do after that is I'm going to show you some things that you can do at home, and I'm going to send you home with a stim unit that I want you to use throughout the week. And then you can just bring it back to me when you're done with it, okay? Awesome. So we need to, again, the key here is one of the other things that it was important to notice, he did have x-rays. X-rays are negative, so there's no fractures here. We are dealing with, soft tissue contusions. But again, the area that we're talking about, lots of tendinous structures, really want to make sure we get rid of the swelling right away. So the first thing we're going to do is we're going to use this hypervol, and we're going to just start to kind of what I call drain this proximal pumping station. So there's pumping stations, like basically clusters of lymph nodes, of where our body's going to do a good job of kind of like pulling some of this swelling out. The thing is like lymph nodes and lymph channels are really brittle vessels. They're not like a vein or an artery, so they get clogged super easy, especially when you have this amount of swelling that needs to be pulled out by the lymphatic system. So you take your percussion massager at home, you're just gonna work, and you're gonna do both sides, okay, obviously, but like kind of along this like iliac crest, just on the inside of that, kind of where we're doing like some psoas release and some hip work. Really just kind of working that fluid nice and easy, okay? Light pressure. Doesn't have to be a lot of pressure here. Like maybe just even less than the weight of the Tim Tam itself, or whatever.
Hovering right over.
Yeah, just hover, just like I'm doing here. I'm just kind of hovering around this area. Okay, right, so we're just gonna do a couple minutes like in here. Roll this up. So again, the more you can do this at home, the better, right? Even like, because we know this isn't fractured, like moving that ankle up and down. Move the ankle as much as you can.
That's why I'm skipping the crutches, man.
Move it.
Yeah, I'm like, let me just get what I can.
So remember, our lymphatic system doesn't have a heart of its own, right? So our circulatory system has a heart that pumps the blood all the way down through. And yeah, our heart does kind of does impart some pressure into the lymphatic system, but it's not enough to drain it against gravity, to push it out against gravity. So our lymphatic system relies on our muscle action. So honestly, like crutches, immobilizing this, and icing it are the three worst things that you could do.
Wow.
Yeah, because basically you're constricting the blood vessels and the lymphatic vessels. You're reducing any of the external pumping mechanism, which is that muscle action.
It needs to be active.
And needs to be active, right? So elevation, in the old RICE acronym, the doctor that actually coined that term, he coined that term in like the late 60s, early 70s. I think he wrote it in a sports medicine book in 1972.
Is he alive still?
He is. He actually in 2014 rescinded his statements and apologized to the medical community.
Apologized.
Right. So that was 6 or 7 years ago. So there's just not a lot of evidence to support the whole icing thing.
He came forward and said it.
Yeah. No, listen. When you're wrong, and at least he admitted it, right? So we're gonna start in this hip zone, and then you're just gonna work into this groin. Same thing, both sides. So what I'm gonna have you do is you're gonna take this over. So basically, you can even just leave it in that one spot if you really wanted to, because you see the great thing about these massage guns is they are great at moving interstitial fluid, which is the fluid in between cells. Okay. While that's happening, I'm gonna start to do some lymphatic drainage massage around this ankle. So what we're gonna do is move this bolster in. This is the other reason I like to do the 2 bolster setup. And let's just turn that knee in so it's straight, perfect, just like that. All right, so what we're gonna do now is we're gonna start working on some lymphatic drainage massage. A lot of pressure here. Is this super tender for me to even touch it?
When you touch
the shin itself?
No, to be honest with you, it's really right where it looks
like
right
in this area.
Yeah.
So again, we can see this bruising. Again, this bruising is just that discoloration kind of pooling down into the ankle from gravity, from being on your feet, again, which is going to have to happen. So just understand though, like you'll be able to drain a lot of this swelling out. And as soon as you go back to a gravity-dependent position, it's going to kind of start to come back, okay? But that's why over the next few days it's like so important. So basically what I'm doing is just really light circular massage motions. Right? I'm gonna start to work this all the way up. You see how like I can't even like move your skin. See that? You guys see that? How I can't even it's so swollen. The sausage is so tight in the casing right now that his skin doesn't even move. So by the time we get done with this, the goal is that we get some of this to move. So when you're doing this at home, you're gonna go waist, right, like abdomen, groin, behind the knee, calf, behind the knee, groin. You're gonna do that reverse.
60 seconds?
Yeah, 60
Each
seconds.
spot?
Yeah, 60 to 120, like 1 to 2 minutes in each spot.
Up and
So now what we're gonna do is, again, he's still kind of hitting that percussion gun through these proximal stations. I'm just gonna start to milk this popliteal fossa, or this area behind his knee. Is it tender in here?
No.
Where the knee is? No? Good. So again, the goal here just being to continually drain or give this area, this fluid someplace to go. We need to clear it out. You know, some other things that'll help you this week, like just getting on a bike, getting some cardio in.
pick whoever.
You know what I mean?
Airdyne bike.
Yeah, airdyne bike, whatever. Just obviously the impact hurts right now, so you don't want to go for a run. But like getting your heart rate up is huge.
Really?
Getting your heart, yeah, because you want to increase your tissue temperature, increase your heart rate. That's your circulation, and then you can get it up immediately and start working on some of the ankle exercises that we're gonna give you. Okay.
Okay.
They hit it with the gun. You know, anything that's gonna dilate these blood vessels is gonna be a great way to start to limit and move some of this swelling.
And elevate.
And elevate.
Is there such
elevate,
thing
elevate.
as too much elevation
No.
to the point of no. Not
No.
like numb up or something.
No.
Like
I mean,
3 hours.
if you sit your ass against the wall and throw your legs up for 3 hours, yeah, you're gonna, in small increments, like in 20 to 40 minute chunks, you'll be fine.
Yeah,
you know?
put it back down.
Pillow it up like this, you know, and at night too, another thing you can do is like, it's hard to like pillow up your legs at night, but if you take a dresser drawer, like out of your dresser and slide it under your mattress, like in between the mattress and the box spring, just something to build it up so the mattress is naturally a little bit higher and then you're not wrestling with fucking pillows all night.
Oh, man.
You know what I mean?
Yeah.
Tricks, tips.
Years ago.
So you see how I can move your skin? See how I can move your skin now?
Yeah.
Whereas before I couldn't, it was like so thick.
Yeah.
So we're already starting to see a decrease in that volume. How about this just touching in here? Is that a little better?
Yeah. Seriously.
Yeah, so just keep doing that, man. Just keep hitting that with the gun.
So sensitive up here.
Yeah. Oh yeah. Now again, that could be, did you get hit there? Maybe. It could also be that, you know, again, this whole groin. You know, we know where these general areas of a lot of lymphatic density are, but we don't know exactly where your vessels are compared to like mine or another athlete's, right? So we're just hitting the general areas, right? These general concepts. I mean, if you're not dying, I wouldn't take it. And if you really do need some pain relief, just go with some Tylenol, some acetaminophen. Because an NSAID pain reliever, like a non-steroidal anti-inflammatory drug, is kind of the same thing as icing this. And inflammation kind of has to happen for this healing process to happen. It's just the nature of the beast. Right now, this swelling is immune fluid. It's your immune system's response to this injury. It's the same way your body fights off illness. It's the same way your body deals with injury.
Wow.
It's flooding immune factors. Those immune factors carry with them the precursors to repair. So, insulin growth factor 1. That's being IGF-1 is being called into this area by the inflammatory, we call them inflammatory cytokines, but they're basically signals from the damaged cells to call in for this response. So we don't want to limit that. We don't want to slow that. It's going to happen no matter what we do. So we can either speed it up or we can slow it down. If we're burying it in ice and immobilized, we're just slowing it down.
Gotcha.
It's still going to happen. And the longer we have inflammation sitting in here, the longer we have this swelling sitting in here, the longer you don't have full range of motion, the longer it is before you can go full weight bearing. And the way that our body lays down new collagen, right, new tissue, is it needs stress. We have to stress it on some level.
Okay.
So the longer you're not able to stress this, the kind of the more insidious and, you know, more long-term this issue becomes, you know? See how I can move your skin? Even with that lotion on it.
I could see it. I could see like it's less swollen. That's your. I'm staring at it a lot.
I should have measured it.
Oh, dude.
I should have measured it before and after, but it's all right. There's more time.
Totally.
Okay, move that thing around now. Just keep moving it. Okay? Better, right? So here's what we're gonna do now. So I'm just gonna clean the skin off. At least we can start to see some of these bony landmarks here. What I'm gonna do is hook up the Compex and show you how you're gonna hook it up at home, essentially. Okay? So again, this is a way that we can elicit a muscle contraction. So we're gonna elicit a fast twitch muscle contraction that's non-fatiguing. So that means you can do it for longer periods of time, right? So again, stacking together, elevating the leg, right? And we're gonna do like the quad and the groin with it, okay? So we're gonna hit quad, we're gonna hit calf, we're gonna hit tib anterior, all of this musculature surrounding the ankle. And then while I'm working that side, we're gonna throw the laser on it. So we're kind of double dipping that time. So this is the Compex. It's a battery powered stim unit. I'm not a big stim guy. This is like the scenario that I use it for. And there's no miracle to this. It's gonna be like the meaty part of the shin on the outside.
Okay guys, so really what I'm just doing here is going to fast forward a little bit through this video. We're going to be putting the pads on. So my pad placements are going to be simple: calf, tib anterior, and then hitting kind of two parts of his quad, the VMO and the lateral part of his quad. Going to link all of these things up and put it on the active recovery setting for some lymphatic drainage.
So we're going to set this up. We'll talk about that. So we're going to turn it on. And then we're going to go down to training recovery. Okay. The other cool thing about this unit in particular, it does have a pain relief setting. It's like a TENS unit, like the stim you'd get at PT, right? So we're gonna go to training recovery. So then these just correspond to these buttons here. So I'm gonna hit the next one. This will just go to the thighs, fine. And we're gonna start turning these up. And we're gonna notice we start to get that fast twitch response. All right?
Gotcha.
Start even your foot shaking. Is that too much or is that okay?
It's good.
All right, so you are in control now. You can turn these up as high as you want. Strong but comfortable is what we're looking for. So this is a platinum LED Bio 600 red light and near infrared light laser array. I'll throw a link in the description of the video if you guys are interested in checking these things out. And I do actually have an affiliate code that you guys can use to redeem this. I really love this for a bunch of reasons. I'm gonna lower him down a bit. I love this is because now we can double dip this time. Okay, so this is using a process called photobiomodulation. So basically what's happening is the same way your body absorbs light from the sun. This is actually throwing off radiation. And it's gonna feel warm, like you have like your arm in like the sun, like in a window. That's radiation, and it's infrared light and near infrared light. So there's two switches here. If I turn this one off, it's still on. And you can see how, I don't know if you guys can see this on camera, you see how it's still kind of red? So near infrared light isn't on the visible light spectrum. So it has a deeper penetration depth, and that'll penetrate down to bone, almost, you know? The red light is more shallow, but this has been shown to improve pain and inflammation. It's going to add, it's going to stimulate your mitochondria in your cells to produce more ATP. ATP is the energy of the cell, how it goes through all these different metabolic processes. And while that's happening, I'm just going to start to work this one a little bit. Just rubbing alcohol in a spray bottle, and we're just gonna really clean him well. Make sure there's no lotion here, because I'm gonna tape this whole lower leg for him, kind of on both sides. So, extra sticky rock tape. This you're gonna leave on for like 3 to 5 days, okay? The way I'm gonna do this though is in kind of sections. I'm gonna do this a little bit differently because I wanna give him as much exposure as possible. So I'm gonna cut, you know, basically up to about 3/4 of the way up his shin. We're gonna round both edges on the open side. On this closed side, I'm just gonna split this in half. So that I have 2 basically 1-inch fingers. And I'm gonna cut probably another 2 like this. So we want surface area is the key with this. I'm gonna round these off. Right? So basically what I have now is 2 2-inch wide pieces of rock tape cut into 1-inch fingers, okay? So what we're gonna do is, it doesn't matter where you anchor them. There are people who say that if you don't, you have to anchor them towards lymph nodes. That's not true. There's 0 scientific evidence to suggest that that's necessary. It's decompressing the skin, so our tissues don't know which direction the anchor is on. So we're gonna put them down at the bottom because it makes more sense, because when he pulls his sock up, he's not gonna roll off all this tape. And because he's kind of swollen here, I'm gonna just pull this backing off and add some stretch to this tape. We're gonna lay it down all the way up his shin. Okay? So again, 3 to 5 days, just leave it on. There's gonna be enough space in between these fingers for you to throw those pads. Turn this way. Do the same thing. Anchor this on top of his foot. So because I'm laying this tape down with some stretch, it's going to want to recoil on itself, so it's lifting that skin. You know, this has been shown to decrease swelling by volume. It's just more comfortable than having that compression on, because it's going to make you throb. And this is going to move with you, and you know what I mean? You don't have to do anything to it. So it's just more comfortable for athletes, and that's why I kind of like this modality over, like, you know, a compression stocking or something like that. Okay, if we wanted, we can go all the way up his leg with this. But we're just gonna keep this simple. All right, guys, so that's it for this video. Welcome back to Session Sit-Ins. Gonna be really trying to get some more of these videos up in the future. I do apologize for the length of time in between videos. Special thanks to Charlie the Cannibal Campbell, coming off his Cage Fury victory. Just taking care of some of these shins and ankles after his gnarly leg kicks. So, again, just to recap, some of the tactics in acute care that we saw today. You know, we really focused on getting to the why behind his swelling and not just burying this in ice and giving him NSAID pain relievers. We're really working the lymphatic system, understanding that lymphatic system is an extension of your immune system, and we need to treat it as such, okay? So we use some manual lymphatic drainage techniques. We started with proximal pumping stations, groin, popliteal area, work the ankle, and then in the reverse order. We could also use something like this hypervolt or any percussion gun to move fluid in these proximal areas. I showed you guys some NMES or some neuromuscular electrical stimulation to create that fast twitch muscle response, as well as the red light and near infrared light laser array. So all of the stuff I used today, I will put links in the description for the video below. If you have any questions, definitely leave a comment. If you like the video, please subscribe and hit that like button. I am going to be putting up a lot more YouTube content in 2021, I promise you. Thank you guys for subscribing and staying tuned to the channel, and we wish you guys all the best. Take care.